Hi, I'm Liv. I'm going to be your nurse today, here to do your head to toe assessment.
Hi, Liv.
Hi, what's your name and your date of birth?
My name is Emily Carey, and I was born on 4/10/1996.
Oh my god, it's almost your birthday.
I know.
Tomorrow.
Exciting.
I'm excited for you. What are you doing? I don't
you.
care. Okay, great. I'm just here to do your head to toe. So you have any pain?
No.
Any dizziness or nausea lately?
No.
No? Okay, perfect. So I'm going to start. I'm going to kind of walk you through it so you know exactly what I'm doing, okay? So don't be nervous.
Sounds good.
Okay, so I'm going to start with your scalp and your head, and I'm going to palpate. Make sure there's no dryness, no dandruff. Oh my god, is that lice? No, just kidding. You're fine. Any pain?
No.
Okay, perfect. I'm going to look at your ears. There's no swelling. They're so smelling cute. And your tragus looks great. Any pain?
No.
No, they don't look swollen, so that's great. Okay, now I'm going to check your lymph nodes, okay? So I'm going to start with your occipital, and then your post-auricular, and your pre-auricular, and your carotid, your tonsillar, your submandibular, your submental, your anterior cervical, your posterior cervical, and your supraclavicular. Okay, and there's no swelling, and you didn't feel any tenderness or pain?
No.
Great, so can you lift your shoulders for me? Okay, great. And now I'm going to do your eye exam. So what I'm going to check first is perla, which is to make sure that your pupils are reactive to light and they're equal and they accommodate back to their normal size. So I'm going to have you look straight at my nose, okay? And I'm going to turn my flashlight on. So just look straight at my nose, okay? Okay, that was great. So they are equal and round and reactive to light. And now I'm going to check your cranial reflection. So you're going to keep looking straight at my nose, and I'm going to put the flashlight right in between, okay? So just look straight ahead. Perfect. Your eyes are even, which is great. And now I'm going to check I'm just going to turn the flashlight off. Okay, perfect. The cardinal field of vision. So I'm going to hold my finger up, and you're going to follow my finger, but don't move your head, okay? Great, your eyes move at the same time in the same rate, and it's very smooth, which is great. Now I'm going to check. I'm going to turn my flashlight back on. Oh, okay. Can you open your mouth for me? Say, ah. Perfect. Your mucous membranes are pink and moist, and it doesn't look like your tonsils are swollen, so that's great. Okay, so now I'm going to check your arms, okay? No swelling. Does that have any pain?
No.
No? Okay, looks good, feels good. Your skin looks intact, which is great. I'm going to check your radial pulses to make sure that they're even and at the same time. They're regular and they're palpating just fine. And now I'm going to check your cap refill. It should be less than 2 seconds, but I'm going to check it underneath because you have nail polish on. And it all looks great. Less than 2 seconds. Perfect. So now I'm going to listen to your lung sounds. Okay, great. So what I'm going to do is you have 6 anteriorly, 2 laterally on each side, and 8 posteriorly. When I listen to your bronchioles, your expiration is going to be louder than your inspiration. At your bronchiovesicular, your inspiration and expiration are going to be equal, and at your vesicular, your inspiration is going to be louder than your expiration, okay? I'm listening with my diaphragm. So I'm going to have you take a deep breath. Good. These are your bronchial. Expiration's louder than inspiration. Okay. Vesicular. Good. Okay. Vesicular. I'm not trying to cop a feel. Just gotta listen to your lungs. Great. Now I'm going to listen laterally. Okay. So deep breath. I'm going to check the other side. Deep breath. Okay. Perfect. Now I'm going to have you turn around.
Here, I'll give you
Oh, perfect. Thank you. That will make it easier. Now there's going to be 8 on your back. So deep breath. Good. 1. Deep breath. 2. 3. 4, 5, 6, 7. Perfect. Your lungs sound clear. That's great. So now you can, nope, you're not going to spin around just yet because I'm going to check your kidneys, your CVA tenderness. So I'm just going to, any pain?
No.
No? Any pain?
No.
Okay, great. Now you can turn around. And now I'm going to listen to your heart. Okay, so I'm going to put my stethoscope back on.
Yeah.
Okay, great.
I know, I got worried too, but I'm checking it out.
Okay, anyway. Sorry. To continue, I'm going to start by listening to your aortic, which is on your right sternal border at the second intercostal space. S2 is going to be louder than S1. Great. Now I'm going to listen to your pulmonic, which is on your left sternal border at the second intercostal space. S2 should still be louder than S1. And it is. Now I'm going to listen to Erb's point, which is at the third intercostal space. S2 and S1 are going to be equal. And now I'm going to go down to your tricuspid, and that S1 is going to be louder than S2, and that's at your fourth intercostal space on your left sternal border. Great. And now lastly, I'm going to go down to your mitral, which is also your apical, and it is at the fifth intercostal space. Yep. Mid-clavicular line. That's the one. And S1 is still going to be louder than S2. Great. And I'm going to flip around my stethoscope and I'll listen to those same 5 spots with my bell, just to make sure that I don't hear any bruits or murmurs. Speaking of bruise, I could go for one right now.
Same.
But I won't because I'm doing my job. Okay, perfect. So that all sounds good. I'm going to flip this back around and I'm going to auscultate your carotid arteries, okay, one at a time. So take a deep breath. Let it out. Deep breath. Let it out. Great, so I don't hear any bruise or murmurs there either. So now I'm going to palpate each side of your carotid, and I'm going to listen to your apical at the same time to make sure that they're going at the same rate, okay? Good. Great, you have a heart, so that's amazing.
Is good.
And it sounds beautiful. You have a beautiful heart. Okay, so now I'm going to have you lay down. And I'm going to listen with my bell to your arteries. So I'm going to flip this back around. I'm going to start with your descending aortic. And I shouldn't hear anything. And I'm going to do your renal on both sides and your renal. And then your iliac and your iliac and your femoral and your femoral. And now I'm going to flip around my stethoscope and use my diaphragm, and I'm going to listen to all 4 quadrants to make sure that you have bowel sounds. I'm going to listen up to 5 minutes to make sure I hear something. You have active bowel sounds, which is great, in all 4 quadrants. So now I'm going to palpate. You let me know if you feel any tenderness or pain. Your abdomen isn't distended, which is great. No pain?
No pain.
Perfect. Okay, I'm going to have you sit up, and I'm going to check your patellar reflex at your knee. Perfect. Well, don't fake it on me.
I got nervous.
You don't have a reflex. There it is. It's small, but it's there. Perfect. Okay, so now I'm going to check. I'm going to sit back a little. Small space. Check your legs. There's no swelling, no edema. You're ticklish, I can tell. Perfect. There's no pain.
No pain.
You haven't shaved your legs in a bit, have you? It's okay. Me neither. Okay, perfect. Now I'm going to check your capillary refill on your cute toes. This little piggy went to market. Just kidding. Okay, and it's less than 2 seconds on all of them, which is great. I'm going to feel for your dorsalis pedis pulse. Great. They're equal and bounding and regular. And your posterior tibialis pulse on both to make sure that they're equal and regular. Okay, I think that just about does it. So great to see you. Have a wonderful day.
Thank you.
I'm going to go get a drink.